नमस्कार। सभी दर्शकों का स्वागत है इस टीचिंग लर्निंग इंटरवेंशन फॉर इंक्लूसिव क्लासरूम के खास सत्र में। मैं हूं आपके साथ सुषमा शर्मा। दोपहर के 12 बज चुके हैं और ये जो विशेष सत्र है आज हम लेकर आए हैं उन सभी विद्यार्थियों के लिए, उन सभी बच्चों के लिए जो कहीं ना कहीं एक श्रवण की अक्षमता से जूझ रहे हैं, लड़ रहे हैं और कहीं ना कहीं बहुत परेशानियों को झेल रहे हैं। क्योंकि मैं सीधा इशारा कर रही हूं वर्ल्ड हियरिंग डे की ओर। आज है विश्व श्रवण दिवस, यानी सुनने की जो अक्षमता है उस पर विचार हम करेंगे, उसके बारे में बहुत कुछ जानेंगे हमारे अपने एक्सपर्ट के जरिए। लेकिन उससे पहले मैं बता दूं कि इस वक्त हमारे सभी जो लिसनर्स हैं, हमें सभी देखने वाले जो दर्शक हैं, इस वक्त हमसे जुड़ चुके हैं एनसीईआरटी ऑफिशियल यूट्यूब चैनल पर। इसके अलावा एनसीईआरटी पीएमई विद्या क्लास नंबर 1 से लेकर 12 पर। और आप भी हमारे इस सत्र का हिस्सा बन सकते हैं, हमें फोन कॉल भी कर सकते हैं। हमारा नंबर इस समय स्क्रीन पर आप देख रहे हैं 8800440559 और लाइव चैट बॉक्स में जाकर भी कोई प्रश्न है आज के विशेष सत्र से जुड़ा हुआ तो वो भी पूछ सकते हैं, या फिर मेल के जरिए भी आप हमसे अपनी बात रख सकते हैं। हमारी मेल आईडी भी स्क्रीन पर इस समय आप देख सकते हैं dth.class12@ciet.nic.in, यानी ये जो मेल आईडी है क्लास 1 से लेकर 12 तक आपके लिए है, आप इससे जुड़ सकते हैं। और देखिए बहुत जरूरी बात आज हम करेंगे क्योंकि WHO के अनुसार 2007 में ये ऑब्जर्व किया गया वर्ल्ड हियरिंग डे। और बहुत सारी परेशानियां होती हैं, क्यों है ये हियरिंग लॉस डे बाय डे क्यों होता जा रहा है, क्या बहुत सारे ऐसे कारण हैं, तकनीकी का जमाना है, बहुत सारे ऐसे हियरिंग एड्स भी आ गए हैं जिससे कि इस समस्या का समाधान देखा जा सकता है। हम बात करेंगे विस्तार से, लेकिन परिचय करा दूं हमारे जो मेहमान हैं। इस वक्त हम मेरे साथ स्क्रीन पर आप देख रहे हैं इंटरप्रेटर है, भारतीय सांकेतिक भाषा से जुड़े हुए हैं। मेरे साथ हैं आशीष गहलोत। आशीष, आपका भी हम बहुत बहुत स्वागत करते हैं। नमस्कार। आशीष जो है प्रत्येक बात को, जो भी मैं कुछ बोलूंगी उसे अपनी सांकेतिक भाषा के जरिए उन विशेष आवश्यकता वाले सभी लोगों तक पहुंचाने का पूरा प्रयास करेंगे। नाउ इट्स टाइम फॉर मी टू इंट्रोड्यूस आवर गेस्ट फ्रॉम मैसूर। Yes, she is Dr. P. Manjula and she is Professor Audiology AIISH Mysore. Hello and very good afternoon Manjula ma'am. नमस्कार।
नमस्ते।
आपका बहुत बहुत स्वागत है जी।
Thank you.
मैडम जो है इस समय प्रोफेसर के तौर पर कार्यरत हैं ऑल इंडिया इंस्टीट्यूट ऑफ स्पीच एंड हियरिंग, जो कि मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर के अंतर्गत आता है। और बहुत सारे प्रावधान हैं इस समस्या से निजात पाने के लिए। लेकिन सबसे पहले मेरा एक प्रश्न रहेगा मैम आपसे कि व्हाट इज हियरिंग लॉस, आखिर क्या है ये हियरिंग लॉस, हाउ वुड यू डिफाइन इट?
So let's start with this question on what is hearing loss.
Right.
Before that, if you can understand what hearing is, then it will be easier for us to understand what hearing loss is.
Right.
So hearing is what we are doing right now. We are listening to Madam asking me questions and she's addressing you and I'm speaking now. All this and
sorry ma'am, we are not able to hear you. There is some audio problem. So it's not that I'm not able to hear you. So I can say that I'm not able to hearing you. So it's not, people can understand that I am having hearing loss, not that. Here's some technical issue so that I'm not able to hear you ma'am. Hello Manjula ma'am.
Hello.
Am I audible right now?
Hello, am I audible now? Hello. Yeah, I'm
Manjula ma'am, I think
audible?
You have muted your audio somehow.
It's on. It's on.
मैम आपकी आवाज मेरे तक नहीं पहुंच रही है, फिर भी मैं आपसे
Hello?
फिर से प्रश्न करूंगी कि हियरिंग लॉस होता क्या है, आप
It's
इसे एक बार
working
डिफाइन
fine
कर
from
दीजिएगा।
here.
मंजुला मैम, व्हाट इज
Yeah,
हियरिंग
hello?
लॉस, हाउ वुड यू
Hello?
डिफाइन इट मैम?
Okay. So hearing loss is that if we find reduced ability to hear, then we call it hearing loss. Okay. So if somebody is speaking, I'm not able to hear that, I'm not able to understand that, then we call it a hearing loss. So this happens because of any problem in the ear. So we can see the model of the ear here. So in this, the part that we see outside, the outside part, external ear, is the part that we can see, but the more important parts are there within the ear inside. So here we have, as we go inside, we can see the external canal, and then we also have an eardrum here. This is the eardrum. And if there is any damage to that part of the drum, also the hearing loss can be caused. And we have small bones in the middle ear, which can also have some problem, due to which we have hearing problem. And then finally we have the inner part of the ear, which if there is a damage to this inner part of the ear, we can experience some problem in hearing, that is reduced ability to hear. Okay, so these are the different parts of the ear, and depending on which part of the ear is affected, again we have different treatment options based on the part of the ear that is affected.
Okay, ma'am. So you have defined it, what is hearing loss. But how to identify it, ma'am, that person is suffering from hearing loss? That is very important.
Yeah. So in our neighborhood, maybe some of us might have come across people having hearing problem. So to identify the individuals who have hearing problem, these people will have problem when we call them. They may not respond to their name call. That is one of the symptoms. And then when we talk to them, they may understand something else, or they may keep on asking for repetitions. बार बार क्या कह रहे हैं पूछते हैं वो. So इससे हमको पता लगता है कि उनको सुनाई अच्छे नहीं दे रहा है. So इससे हमको पता लगता है कि sometimes what happens, there can be discharge from the ear. Okay, so if there is ear discharge, that can also cause problem. If there is an ear discharge, that is associated with hearing problem. And sometimes what happens is there is some ringing noise in the ear. Some goo आवाज आते रहता है कानों में से.
Okay.
This आवाज, when there is a आवाज like that, we can doubt that there is some amount of hearing problem that the person is experiencing. So these are all some of the signs and symptoms used based on which we can identify that a person is having a hearing problem. Apart from that, we also have some instruments which we use, because this hearing loss can be identified even at birth. So a newborn child, we go to the hospitals and identify the problem in hearing. So we have instruments like this, which we carry to the hospitals, the maternity hospitals and all, and we insert this into the ear of the child and some measurements to identify the problem. So we have different specialized instruments to measure and identify the problem in hearing.
Okay, we will talk about the instruments or devices also later on, but what are the main causes of hearing loss?
Okay. So I was just now telling you about the different parts of the ear. So you have the part of the which is called the external ear, which we can see from outside. So if there is any impacted wax here, or if there is a foreign body that is obstructing the sound pathway inside the ear, so all these can cause problems. Sometimes what happens, if there is a wax there, people try to take it out using sharp objects, maybe hairpin, safety pins.
Like matchbox.
That is not advised. That is not advised. Actually, naturally the wax comes out on its own. So we don't have to remove it. Only when it gets hard there, then we have to go to an ENT doctor and get it removed. Otherwise, there can be more problems in hearing also. So coming to the middle part of the ear, what happens, young children, they are more prone to get upper respiratory tract infections such as cold, cough often. So the upper part of the throat is connected to the middle ear. Okay, the infections can easily spread to the middle ear, and there can be infection in the middle ear also. So at that time, there can be ear discharge because of the infection in the middle ear. So this can also cause problem in hearing. So apart from that, in the inner ear, we have a small part which is called the cochlea, which is in the shape of a snake. Okay, so here we have very delicate small cells of the ear, which are sensory cells of the ear, which are very important for hearing. So if there is any damage to them, for example, some of us have the habit of listening to very loud music.
Okay.
And some of us have the habit of using mobiles for a long time. So all these, the individuals are prone to develop hearing loss because they damage the small delicate cells that are there within the cochlea, which is in the inner part of the ear.
Okay.
And due to old age also, some of them acquire hearing loss. Like we get problem in vision due to old age. Likewise, we also get problem in hearing due to old age. And these are some of the causes of the ear. Like at birth, the child can have some, when the child is being born, the child, usually all children cry soon after birth. Okay. So if the child doesn't cry soon after birth, that means to say the oxygen intake is not happening. And because of that, the organs which are required for hearing or any other part of the brain and things like that, they may get damaged because of the reduced supply of oxygen. So all these, and then if there are infections that the mother has acquired before, during the time of pregnancy, especially during the first 3 months of pregnancy, if the mother gets infections such as rubella, measles, things like that, there are more chances that the child can have hearing loss.
बिल्कुल, आपने बिल्कुल सही बताया कि एक माँ से भी बच्चे को ये इन्फेक्शन हो सकता है और जिसके कारण उसका हियरिंग लॉस हो सकता है। तो बहुत सारे कारण बन सकते हैं, लेकिन बात आती है यहाँ पे कि बच्चे हो या बड़े हो, उनको कैसे प्रिवेंट किया जाए, उनको हाउ टू प्रिवेंट देयर हियरिंग लॉस, because certain things are in our own hands, so we can control on this, but those particular things.
Fortunately, 50% of the hearing loss is preventable.
Yes,
so there are lots of ways through which we can prevent the hearing loss. One is, I was telling you that the maternal infection can cause problems in the child which is in the womb, and if the mother has taken appropriate immunizations, for example, that can prevent infections in the mother. And soon after, if the mother is having the infection, if they consult, especially it has to be delivered under the medical supervision. If the child has to be born, it has to be done in a medical setup under medical supervision. So that if there is a delayed birth cry, the medical professionals who are there will take appropriate care so that the child cries immediately. So such things can be done. As well as if the child is more prone to get upper respiratory tract infection, we will have to prevent cold and cough, the child may have to intake less of like something like ice creams or some of the fruits which may cause this kind of a problem. And then if there is any other child who has got this kind of a problem in the classroom or maybe in the neighborhood, then we will have to prevent the child who is who is playing with them. Maybe we'll have to use appropriate masks so that there is no transmission of these infections to this particular child. And listening to mobile phone, we will have to limit the time. And then some of them, they work in such environments such that their entire time is spent by using these headphones. So at such times, we will have to give them breaks in between, and we have to make sure that they hear it at a lower volume levels, about 60% of the volume of the total range that is available. If only 60% of the volume is used, then we are at safe levels.
Very true, ma'am, because it's in our own hands. So high volume, बहुत तेज आवाज में आजकल संगीत सुनना, म्यूजिक सुनना भी एक बहुत बड़ा एक आपके हेयरिंग लॉस का कारण बन सकता है. और not only for the children, even the elders or the olders, both can be affected with this hearing loss. Ma'am, can you show us the different parts of the ear once again here to our viewers?
Sure. So this is the model of the ear. So this part of it, which we see from outside, this part of it is seen here in this model.
Okay.
This is the external ear, and the ear canal is there. This is where the wax is produced, and it comes out naturally. We don't have to take it out. Sometimes in case it gets impacted, it becomes hard, then we will have to reach out to a doctor to get it removed. And then we have the middle ear, where we have eardrum and the small bones which are attached to one another, which transmit the sound from the outside ear to the inside part of the ear. So, and then we have the inner part of the ear. So this inner part of the ear, we have the part which is important for hearing, and also part which is helps us in balance. And balance, both of is located in the inner ear, inner part of the ear.
Okay. So this is the model where you have described ki what are the, I think it is very sensitive. Sensitivity is very important for everyone. So be careful about hearing loss is really, it is very dangerous, and especially if we talk about the small children, and it is a very challenging job also for their parents and teachers as well, to how to deal with them, how to deal with those children. So ma'am, one more question comes to, what are the different parts of ear, as you have told us, and different types of hearing loss if we talk about. So what kind of hearing loss we usually find in children?
So we can have hearing loss which can occur due to the problem in the external ear or in the middle ear. Okay, so if the problem is in the external ear or in the middle ear, then we call it a conductive loss. That means if there is problem in conduction of sound to the inner ear. Okay, so if there is any problem in the middle ear or external ear, most often they are curable. That is, they can consult an ENT doctor and get medicines or surgery done so that the problem in hearing gets resolved. However, if the problem is in the inner ear, then we call it a sensory neural type of hearing loss, and this inner ear problem cannot be cured with medicines or surgery. So this will be a permanent damage. The exposure to loud noise, loud music happens in the inner ear.
It is very thin wall. It is very thin wall which damage or rupture.
It has very delicate cells there inside, so that will get damaged, and once the damage occurs, it is a permanent damage. So we will not be able to cure that kind of a hearing loss. For them, we have a solution, however. So solutions are in terms of the usage of hearing aids that are available.
Okay,
so
this is the device. Okay.
Yes.
Ma'am, as the technology is increasing day by day, so what all kind of devices are there in the market, or what the 𝐴SH is doing to promote the new devices or some new technologies?
So first, before we go into the hearing part of it, hearing aid part of it, we will have to find out, we will have to do hearing evaluation and find out which part of the ear has got damaged.
Right, ma'am. So would you like to do some demonstration here?
Okay. So like we have, this is one instrument that we have. This is called an otoacoustic emission analyzer.
Right.
So this part of it, all these days we thought that the ear only hears sounds from outside. So now we also know that it generates some sounds. Okay, so that generated sound is measured by this tiny equipment that goes inside the ear. So newborns will not be able to tell us that they are hearing or not. They are very young. So for them, we have to use some objective tests like this, where if we put some probe here and then generate some stimulus, there is some reflection of sound which is measured in this and tells us whether the child has passed the test or whether it has not passed the test. Depending on that, we do a detailed diagnostic evaluation to find out using audiometers. We have audiometers which are there. So that has to be done in a sound treated room, because the outside sound should not enter and affect our hearing testing. So we have sound treated rooms which will attenuate the sounds, the external sounds from entering inside the test rooms, and inside that we use the audiometers, put the headphones and test each ear separately to find out what is the problem on the right side and on the left side. So sometimes the problem can be more on one side and lesser on the other side, or it can be the same on both sides. So all that we can measure using an audiometer. So we can also find out using different measuring instruments such as immittance meter about the problems in the middle ear. So like that, for each part of the ear we have specific instruments using which we can. For school children, we usually use this one handheld audiometer. It is called pediatric audiometer. So this will generate sounds, and the child will have to respond saying that the child heard the sound or did not hear the sound. So this way we can make out what is the softest sound that the child is hearing, and accordingly we can classify the degree of hearing loss and the type of hearing loss.
Okay, very well said, ma'am. Ma'am, now we come to the noise pollution or noise exposure, we can say. So how would you define how it works, that noise exposure is really dangerous for the children as well as for the elder or the older person?
Yes, madam. So this is really causing a lot of concern these days. because there is in the environment there is a lot of noise, the traffic noise it could be, or people working in a noisy industry, or it could be children playing with the noisy toys even. Okay, so these noisy toys which generate a lot of noise, all these are quite dangerous to our hearing. So we have, for those people who are working, for example, what I'm talking now, if there is a person who is at a distance of 1 meter distance, he'll be hearing my speech at about 60 dB level. That is the intensity by which we measure the loudness of my speech. So the noise which is dangerous is not 60 dB. My speech is not dangerous to my ears. If it exceeds a certain limit, something like 80 dB or 85 dB and above, then it can cause a problem in hearing. So we should make sure that in such instances, we will have to use ear protective devices like this.
Okay.
This is an ear protective device which we will have to wear like this. This attenuates the sounds that are coming from outside from reaching the ears. So this way we can protect the hearing. And also for those people who are working in an industry and all, their equipment which generates noise, we have to maintain that equipment very well by lubricating the parts, maintenance and all that. So when we do that, it generates lesser noise. And such things can be even. And even in mobile phones, some of us have the habit of listening to very loud music. So such, we will have to reduce the volumes and listen to it.
Very, very true, ma'am. So one more question. Can hearing loss be cured?
Yes.
Is it possible? Or what kind of hearing loss is curable?
Certainly, certain types of hearing loss can be curable. I was mentioning that there is if there is any infection in the ear, then antibiotics are prescribed, and then the ear discharge can be prevented, and any infection in the ear can be prevented. And there are certain surgeries that can be done on the middle ear so that the hearing, the problem is alleviated. Whereas if the problem is in the inner ear, the sensory neural problem inside the cochlea, then this is a irreversible one where medicines or surgery will not help. In such instances, we have solutions, audiological solutions for them using these kinds of hearing aids. These are the hearing aids which are available. There are many types. This is the one which is called behind the ear because it is born behind the ear like this. So, and along with this, we have to use an ear mold to anchor it inside the ear so that it doesn't fall off.
Okay.
So this is one type of hearing aid.
And this is chargeable. You have to use through Bluetooth. I think so.
This is chargeable in the sense this has to use a battery cell, which we need to keep changing it when the battery goes down. We have to change, and it also got Bluetooth. Okay,
also.
so it can stream. Yes, correct. So, for example, in a classroom situation, if the child has got a problem in hearing, the child is not hearing the teacher's teaching, then they have something called a multi-mic. This is a microphone that the teacher clips onto the clothing, and then the child who is wearing this can stream the signals from here directly through Bluetooth to this. Okay, so that the child hears it as if the teacher is directly speaking to the child. The outside noise will not affect the teacher's speech. So that way the child hears the speech in the classroom quite clearly. And this can be used even at home. Old individuals will be there and then they will be seeing the TV problem and all. So in such instances, there are TV streamers which are available, which can be used along with the hearing aid. So these TV streamers can be connected to the television and the signals directly get streamed to the Bluetooth hearing aid.
Okay, ma'am, one more question comes to my mind. What education services are provided by the government for children with hearing impaired?
So, all these children with hearing impairment like they have to go to the schools and get educated. Some of the schools are denying admissions for them, which shouldn't happen. According to the rights for persons with disability, no one with a problem or disability can be denied admission. So this we have to keep in mind. And then once the child is admitted, we have to create environments in the school for accessibility, in the sense if the child is physically disabled, then ramps and all. If the child has got a hearing problem, then providing them with such devices where the child can hear the teacher's speech well.
Right.
All that should be made available to them. And one more thing is, these children will have problem in, if the hearing loss is there from birth, the child will have problem in acquiring speech and language. So if the child has problem in acquiring speech and language, the child will have problem in acquiring 3 languages which the schools, in the schools they have to learn. First language, second language and third language. So because of hearing problem, it will be difficult for them to learn 3 languages. So the government has made a rule saying that for children with hearing impairment, there can be single language formula.
Okay.
The second and third languages are exempted for them.
Great.
But there are other children with hearing loss who can acquire more languages. They acquire and do well. But only for such children who do not acquire more languages, then a single language formula is there. They can get help by them. And then they also have scholarships, educational scholarships, and they are provided with these hearing aids free of cost.
Okay.
Through schemes such as ADIP scheme of the Government of India, which comes under the Ministry of Social Justice and Empowerment. These hearing aids are given free of cost for those individuals who cannot afford for the hearing aids.
Okay. So many things are there by the Government of India as well, but we have to just do the search, and we have to just go through the right channel how to get it for their children, and it depends on the teachers also to find out their disability of hearing loss, or we can say it is totally depend on each other. It is a better way to communicate with the children. And now it's time to wrap up also, but before that I would like one very important question. What kind of challenges usually we find with the children of hearing loss?
So main challenge is that, as I said earlier, the child will have problem in acquisition of speech and language, because of which the child can have problems in academic situations, academic achievements. So to prevent that, we will have to do early identification. Early identification is like identifying the hearing loss at an early stage and instituting management, whether it is medical management or audiological management. We will have to start it early so that the impact of hearing loss is reduced. Right. And then the child will have lesser problems.
Thank you so much, ma'am. Thank you, P. Manjula ma'am, for being with us and talking about on World Hearing Day. And with your model, and so many devices were there, and you have demonstrated very nicely. I hope all the viewers would have learned a lot about today's special session on teaching learning intervention for inclusive classroom. Thank you so much for being with us, ma'am. Thank you. और अब दर्शकों को बताना चाहते हैं कि ये था हमारा एक विशेष सत्र, जो कि आज विशेष तौर पर जो इस तरह की समस्याओं का सामना कर रहे हैं उनके मैथमेटिक्स का क्लास 1 के लिए फाइंडिंग द फरी कैट, ये प्री नंबर कॉन्सेप्ट है। और 2:30 बजे हम लेकर आएंगे हिंदी का विषय झूलम झूली, 3 बजे होगा इंग्लिश का द स्मार्ट मंकी, और 3:30 बजे सेकंड क्लास के लिए मैथ्स होगा अ डे एट द बीच, और 4 बजे होगा हमारा ट्रेनिंग सेशन का द साइबर सेफ्टी इन AI ड्रिवन वर्ल्ड, और 5 बजे होगा हमारा सहयोग, जिसमें आज का टॉपिक है कॉपिंग विद डिस्ट्रैक्शंस ड्यूरिंग एडोलेसेंस। तो ये थे हमारे कार्यक्रमों की रूपरेखा। फिलहाल मैं सुषमा लेती हूँ आप सभी से अनुमति। खुश रहें, मुस्कुराते रहें, अपना ख्याल रखें, स्वास्थ्य का जरूर ख्याल रखें। नमस्कार।